Hello and welcome to the Canada News. I am Divya Rai. And now top stories of the day. NDP leader Jagmeet Singh once again demanded to Prime Minister. Brampton North MP Ruby Sahota asked what steps the government is taking to help Ontario. Health Minister Christine Eleanor has announced new emergency health measures. The biggest story of the day today. NDP national leader Jagmeet Singh once again demanded that Prime Minister Justin Trudeau, instead of talking about the provinces regarding the paid sick leave program, make the program effective so that it benefits the workers. At present, no one is benefiting from it. At the same time, Jagmeet Singh has demanded a proper probe in the General Wang case.
We know that it has been repeated again and again by experts, paid sick leave will save lives. And what we have is at the federal level a paid sick leave program, but it just doesn't work enough. And the government knows this. Justin Trudeau knows this. It knows that it's not working and can make it better. And it is not helpful to get into a blame game or get into a standoff, whether the provinces should do it or the federal government should do it. We just need to get it done. There's already a program that exists, just make it better. This will save lives. Justin Trudeau is not doing enough by just saying we've got something, it's not adequate, but it's there, and just crossing his arms and standing off on the sidelines. That is not good enough. We need to improve it immediately. No worker should go to work sick. Experts are telling us that is where people are getting sick. They're getting sick at work, and then they're bringing it home to their families, and their families are getting sick. This can stop. We can put an end to this if the Liberal government, the federal government, if Justin Trudeau just brought in paid sick leave that worked. Just improve the program, make it work. That's what we're asking for. We're going to continue to push for it. This is vital. This will save lives. And on the ongoing issues in the Canadian Forces, I want to be very clear. Justin Trudeau at this point knows everything. You know, if there's a question of who knew what when, we can put that aside and say right now, what is Justin Trudeau going to do? Knowing what we know right now, what are you going to do? How can he allow a minister to continue to be there who completely ignored complaints brought up by women? What message does this send to women in the Canadian Forces? Right now, if you raise a concern as a woman in the Canadian Forces and it makes it to the highest level, it goes to the Ombudsman and it makes it to the Minister of Defense, then nothing's going to happen. That is already sending a chilling message to women in their armed forces that they are not safe, that they're not going to be listened to. That is wrong. Justin Trudeau needs to do something now. What is he going to do? What are the steps he's going to take? What action is he going to take to remedy this problem, to fix this problem? Right now, there is a serious issue.
Brampton North MP Ruby Sahota asked what steps the government is taking to help the province as Ontario is struggling with the third wave of COVID. Responding to the question, Prime Minister Justin Trudeau said that Canadian Armed Forces and the Canadian Red Cross were providing all possible assistance to Ontario.
Many of my Brampton North constituents are concerned about the third wave of the pandemic. Across Ontario, hospitals are filling up, new cases continue to exceed 3,000 per day, and additional help is needed. I know that this federal government has often said what is needed is a Team Canada approach to addressing this pandemic. Can the Prime Minister please tell this House what actions the Government of Canada has recently taken to provide support to the people of Ontario during this pandemic?
The Right Honourable Prime Minister. Mr. Speaker, allow me to begin by thanking the member for Brampton North for her leadership during this difficult time. I want to reassure all Canadians that we will always be there to provide assistance to provinces and territories. Just this week, we approved a request to deploy immediate support to Ontario through deployment of the Canadian Armed Forces and redeployment of the Canadian Red Cross. Over the course of this pandemic, we have now approved 70 requests for assistance, including 22 from Ontario. We will continue to do whatever it takes for as long as it takes to help Canadians get through this COVID-19 pandemic.
The number of patients in the hospitals in Ontario is increasing, so patients from the hotspot areas are being transferred to hospitals in other regions. In view of this, Health Minister Christine Allenor has announced new emergency health measures which have suggested other measures to increase the powers of doctors.
Ontario, like many other provinces and jurisdictions around the world, is in the midst of the third wave of the COVID-19 pandemic. Driven by variants that are more transmissible and more likely to lead to hospitalization, this wave has proven to be much more difficult to deal with. Our government continues to use every tool at our disposal to address the challenges facing our hospitals. This includes redeploying staff to where they are needed most, transferring patients to alternate hospital sites in surge situations to maximize system capacity, and ensuring that our hospitals have the resources required to provide care for patients. These have not been easy decisions, but they are necessary ones. Today, we are taking further action by temporarily amending an emergency order to ensure hospital beds are available for COVID-19 patients in need of urgent care, while ensuring every patient is able to receive quality care in the most appropriate setting. This temporary emergency order will provide hospitals with the flexibility to transfer certain patients, those whose doctors have determined no longer require hospital care and could be better supported in a more appropriate setting, to a long-term care or retirement home. This would be done in only the most urgent of situations, when a hospital is at risk of becoming overwhelmed. We will ensure patients or their substitute decision makers will have the opportunity to be actively involved in and consent to their transfer. Hospitals may rely upon this order only when absolutely necessary to respond to a major surge event and when the attending physician is satisfied that the patient will receive the care they require in their new setting. I want to emphasize that these patients are often waiting to receive care in another setting. The most appropriate care for them is not always in a hospital bed. These transfers would only be made when medical professionals are confident they will not compromise the patient's medical condition and after a full consideration of any ethnocultural or language concerns.
The third wave in the province of Ontario has hit small businesses hard, with the opposition once raising the small issue of small businesses and questioning the government's grant program. Associate Minister Prabmeet Singh Sirkaria claimed that $2.5 billion has been disbursed under the Small Businesses Support Grant. 57,000 businesses entitled have also received their second payment. According to the government has always stood by the businesses community.
Thank you, Speaker. We're in the middle of an entirely avoidable third wave. Small businesses continue to struggle to even access funds that were promised to them after the Boxing Day lockdown during the second wave. They're still waiting for leadership from this government. There's a laundry list of complaints from small business owners about the Small Business Support Grant. My colleagues and I have also reached out countless times asking for support for our business constituents who employ 80% of the workers in Ontario. It's gotten to the point where the problems with this grant program are jeopardizing livelihoods and will undermine economic recovery. Speaker, to the government, what went wrong with the grant program and why is it taking so long to fix it and to support small businesses across this province?
To reply, the Associate Minister of Small Business and Red Tape Reduction.
Thank you very much, Mr. Speaker, and I appreciate the question from the member opposite. We understand that businesses have been faced with incredible pressures throughout this pandemic, but the Small Business Support Grant has, as of today, paid out $2.4 billion in payments to small businesses, 107,000 first payments and an automatic doubling of which was committed to in the previous budget of that. 57,000 businesses have also received their automatic second payment in that support grant for over $873 million.
For Hamilton Mountain, come to order.
In terms of some of the delays some businesses are experiencing, we have tripled the support staff on the back end to ensure that we get back to those businesses in as quickly as possible and ensure that they can get the supports and money into their bank accounts, because we do recognize this is a challenging time. But over 107,000 first payments and 57,000 second payments for over $2.5 billion in direct support.
Okay. The next question, the member for Guelph.
Ontario Labour Minister Matt Norton has announced that provincial government is offering the best paid programs for workers. He announced that workers affected by the COVID-19 epidemic would be given 3 days paid sick leave by the government. In this case, the workers will be paid $200 per day for 3 days.
Since the start of the pandemic, we've had workers' backs. We had their backs when Premier Ford negotiated with Prime Minister Trudeau a $1.1 billion fund for paid sick days last summer. We had their backs when we advocated to Ottawa for workers to have repeat access to the federal program, faster payments, and 20 paid sick days instead of 10. And we've got their backs again now. With the new variants of concern, workers in Ontario need more support now than ever before in our fight against this deadly virus. At the start of this pandemic, Ontario was the first to introduce unlimited job-protected leave so that nobody had to choose between their health and their job. And today, I'm pleased to introduce the Ontario COVID-19 Worker Income Protection Benefit. With the federal government indicating their openness to double payments through their program, we are stepping up to fill these gaps. We are the first in the country to double payments for the federal sick days program. With this new additional provincial funding, workers could now receive a total of $1,000 a week for 4 weeks. Make no mistake, Ontario workers now have access to the most generous sick pay program coast to coast. A persistent gap in the federal program is that workers must miss half of their work week to qualify. To fix this, our government will also lead the way by introducing the COVID-19 Putting Workers First Act. Through this bill, we are the only province in Canada to introduce paid sick days specific to COVID-19. If passed, all workers will soon have access to 3 paid sick days.
Toronto Mayor John Tory briefed the City of Toronto on the COVID-19 vaccine rollout process, adding that more than 1 million citizens in the city have been provided with the COVID-19 vaccine. He said the team, in the collaboration with the Toronto healthcare partners, hospitals and pharmacies, is leading the vaccination campaign.
To update, more than 1,104,855 doses of COVID-19 vaccine have now been administered by Team Toronto within the City of Toronto. And Team Toronto, of course, includes our hospital partners, healthcare partners, city staff, and Toronto Public Health. And more people are becoming eligible to get vaccinated. In cooperation with the province, we've now lowered the eligibility age in our city-run clinics to 45 or older for people who live in the 53 identified hotspots, which you can see at toronto.ca/COVID-19. Starting tomorrow, childcare workers in licensed childcare settings will also be eligible to book an appointment at a city-operated clinic through the provincial booking call center at 1-833-943-3900. As this month comes to an end, we know that next month will bring a lot more vaccine doses, and we will run in a situation out of the valley that we're currently in. This will allow us to ramp up the capacity we have in Team Toronto. We've had that capacity in place for some time to get more shots in more arms. All we needed was more supply. To all the people who are eager to get vaccinated but not yet eligible, please know that day will come soon as supply increases and we're able to get through the initial groups established by the province. This morning, we announced that the city is partnering with Vaccine Hunters Canada to assist Toronto residents in identifying available next-day appointments at the city-run immunization clinics. Getting everyone vaccinated is a huge all-hands-on-deck effort, and Vaccine Hunters have stepped up to help people get vaccinated and to navigate the different registration systems. I want to thank Councillor Cressy and City staff for working with Vaccine Hunters to find a way we can share information on available appointments in city-run clinics. It is a volunteer organization, Vaccine Hunters that is doing great work. They're exactly the type of group an innovative government and city should partner with to benefit our residents.
Toronto Medical Officer Dr. Alan Dibblard briefs on the latest status of the COVID-19 epidemic in Toronto. He said that 1,055 new corona cases were reported in the city today. 1,121 patients are admitted in the hospitals. There are 242 critically ill and are in ICU treatments. At the same time, 13 new deaths were confirmed today.
Today, I am reporting 1,055 new cases of COVID-19. 1,121 people are in the hospital. 242 people are in the ICU. And I'm saddened to report 13 deaths today. Yesterday, I read some figures from Our World in Data, a research and data analysis center partnered with the University of Oxford. It listed Canada as having 30% of the population with at least one dose of vaccine. Only 8 other countries in the world were ahead of us, and 3 of those are the United Kingdom, the United States, and Israel, whose vaccination progress is the envy of the world. Here in Toronto, we are seeing success in targeting the vaccine where it will produce the most effect under the current circumstances. It sometimes feels contradictory to speak to our success in the delivery of vaccinations when there are still so many waiting their turn, and while the third wave is still so dangerous. That danger is why the approach we are taking makes the most effective use of the vaccine supply at our disposal. Toronto Public Health, our hospital partners, and our community partners are all collaborating to deliver the doses we have to best advantage. We are confident that the current hotspot strategy delivers a double advantage. The strategy not only targets the neighborhoods and demographics that are at greatest risk of infection.
Brampton Mayor Patrick Brown provided weekly updates on coronavirus in the city as well as discussing National Mourning Day. He said that on this day, tribute is paid to those workers, those who have an accident while working or died in the workplace. He said the same thing has happened to the frontline workers during COVID.
I want to start off by acknowledging today it's the National Day of Mourning. It's a day we remember those who face workplace tragedies and collectively remember and mourn the loss of workplace fatalities and recommit ourselves to doing everything we can to prevent workplace injury or fatalities. And it's particularly relevant this year given COVID-19 because so many of our frontline workers have faced extreme danger. And I'd be remiss not to mention with Brampton Transit. It was only a short time ago that we lost a Brampton Transit operator to COVID. So the dangers are real, and the City of Brampton will be taking a moment of silence today at our City Council meeting, as will Brampton Transit, to acknowledge the National Day of Mourning. I also want to mention today that this has been a tough week. The loss of a 13-year-old was very tough on our community, the youngest victim of COVID in Ontario, and our hearts go out to the Vegas family. Words don't do justice to the loss that they're going to face, and the reality is that's the risk that's out there right now. When essential workers go to work, the risk is COVID can be contracted. That when we have a stay-at-home order, it's the fact that people from all walks of life can be affected by this insidious virus, and it just really hits home for our community when you see a loss so young. In terms of a vaccine update, the province has announced that we're now opening up the age category for over 45, and this is welcome news because it'll allow us to get more of our population vaccinated. But I would note, as I have been advocating for a long time, We need more vaccine supply to get more segments of our population. And although it's a step forward to have the age threshold lifted to 45, let us not forget the average age of an essential worker in Brampton is 36. So they do not meet that threshold.
Alberta Premier Jason Kenney discusses Calgary Rockview General Hospital's expansion program. He also mentioned the restrictions imposed by Alberta Public Health. He said the way in which the numbers of COVID cases in Alberta has increased in the recent days. Since then, the Alberta Department of Public Health has imposed some restrictions.
Before doing so, I wanted to address a couple of other pressing issues. First of all, I'm very happy to report that yesterday, in a 3-0 decision, the Federal Court of Appeal ruled in Alberta's favor on a critical decision protecting our Canada's Economic Prosperity Act, which some have called the Turn Off the Taps legislation. This is legislation that was brought in a little over 2 years ago to allow Alberta to control exports of our natural resources, and it gave us an additional tool in our toolkit to respond to other jurisdictions that might seek to landlock our resources. I'm happy that since that legislation was brought in, first of all, our government, in its very first act, within hours of being sworn in, proclaimed that into law. It was subsequently challenged by the BC government, and yesterday's 3-0 decision by the Federal Court of Appeal removed an earlier injunction. So it's a very important tool to allow us to protect the value of our resources, and we're delighted with the outcome of that. On another matter, as you know, on Sunday, the regional municipality of Wood Buffalo declared a state of local emergency, and local First Nations in northeast Alberta have also expressed concerns about the high level of COVID-19 spread in the region. And our government has been working closely with local leadership. I know that Minister Shandro and Dr. Hinshaw met with Mayor Don Scott yesterday by phone, and earlier today with First Nations leaders. I've been in touch as well with local leadership. And as I've mentioned before, we have seen a significant number of vaccine doses going unused, and that's why the decision has been made to extend vaccine.
A former long-term care inspector said it's been absolutely devastating. You knew that these problems were inherent and the homes were not prepared. Problems like overcrowding, resident neglect, and lack of infection prevention and control all helped the novel coronavirus spread rapidly through Ontario nursing homes, leaving more than 3,700 people dead. But there are also issues that for years had been flagged in provisional inspection records in many of the Ontario worst-hit homes, often with no changes or accountability. The former inspector, who left the ministry months before the pandemic began, is sounding the alarm over the state of inspections in Ontario nursing homes. The person described a system that is understaffed and overworked. Ontario Commission on Long-Term Care said Premier Doug Ford government needs to take urgent action when it comes to the effectiveness of the province oversight and inspection system. The Commission said the lack of fines and penalties may fade into the lack of urgency for long-term care operations to fix problems with care. So that's it from us in this bulletin. Stay tuned for more updated news.